A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a controversial move, the Trump administration has proposed new regulations aimed at restricting gender-affirming care for youth, igniting a firestorm of criticism from LGBTQ+ advocacy groups, medical professionals, and families of transgender children. The announcement, made by Health and Human Services Secretary Robert F. Kennedy Jr., marks a significant escalation in the ongoing battle over transgender rights in the United States. The proposed regulations include a ban on hospitals that provide gender-affirming care to minors under 18 from receiving Medicaid and Medicare funds, as well as a prohibition on Medicaid and the Children's Health Insurance Program, CHIP, covering such care for youth under 19. During the announcement, Kennedy characterized gender-affirming procedures as sex-rejecting and claimed they impose lasting harm on children, asserting, "This is not medicine. It is malpractice." These sweeping changes come amidst a broader trend of states implementing bans on gender-affirming care for youth. Recent data shows that approximately half of U.S. states have enacted legislation that restricts access to medication and surgical procedures for transgender youth. This wave of restrictions has been met with fierce resistance from major medical organizations, many of which advocate for gender-affirming care as a necessary treatment for gender dysphoria. Research has consistently demonstrated that gender-affirming care, including the use of puberty blockers, can significantly alleviate depression and reduce the risk of suicide in transgender and non-binary youth. The Human Rights Campaign, the largest LGBTQ+ rights advocacy group in the nation, condemned the proposed rules, stating that they aim to put best practice, medically necessary health care for trans youth entirely out of reach in this country. Kelly Robinson, president of the Human Rights Campaign, emphasized the detrimental impact these regulations could have, saying, "Make no mistake, these rules aim to completely cut off medically necessary care from children no matter where in this country they live." The proposed regulations will enter a 60-day public comment period, allowing individuals and organizations to voice their opinions before any final decisions are made. However, the implications of these changes could be profound, particularly for transgender youth who are already facing a challenging healthcare landscape. The announcement also comes on the heels of a U.S. Supreme Court decision that upheld Tennessee's ban on gender-affirming care for youth, reflecting a growing trend across the country. Additionally, the United States Conference of Catholic Bishops recently voted to bar Catholic hospitals from providing gender-affirming care to minors, further limiting access to these essential services. On Capitol Hill, the House of Representatives recently passed legislation that criminalizes doctors who provide gender-affirming care to youth, although the bill is not expected to pass in the Senate. Alexis McGill Johnson, president and CEO of Planned Parenthood Action Fund, criticized the proposed rules, labeling them shameful and asserting that health care should be accessible to all individuals, regardless of their gender identity. During the announcement, Dr. Mehmet Oz, the administrator of the Centers for Medicare and Medicaid Services, highlighted that more than half of children in the U.S. rely on Medicaid and CHIP for their health care. Kennedy also revealed that the FDA would be sending warning letters to manufacturers of chest binders marketed to youth under 18, signaling a broader crackdown on products associated with gender-affirming care. The Trump administration's proposed regulations are framed within a larger narrative that has emerged since the president's executive order in January, which condemned gender-affirming care as chemical and surgical mutilation. Critics argue that this rhetoric is not only misleading but also harmful to the well-being of transgender youth who rely on these medical interventions for their mental health and overall quality of life. Chloe Cole, an activist who detransitioned after undergoing gender-affirming care as a teenager, spoke in favor of the proposed changes, claiming that detransitioners are often ignored by the medical system. However, many advocates caution against using the experiences of a small group to justify sweeping bans on health care that is deemed necessary by major medical organizations. Senator Ron Wyden, the top Democrat on the Senate Finance Committee, condemned the proposed regulations, stating, "Trump and Republicans are attempting to demonize and ultimately erase trans Americans. This cruel and thoughtless step contradicts medical evidence and will jeopardize health care for many communities around the country." As the public comment period begins, the future of gender-affirming care for youth hangs in the balance, with advocates and families urging lawmakers to prioritize the health and well-being of transgender youth over political agendas. The proposed regulations represent a significant moment in the ongoing struggle for transgender rights in the U.S., and the response from the public and advocacy groups will likely shape the future of healthcare access for this vulnerable population. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.